Welcome to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. Today we have a special treat in that we're going to hear from many voices from many esteemed surgeons representing different facets of surgical practice and different time periods and careers and leadership roles. Everyone's come together today to discuss a very important statement that was crafted by the American College of Surgeons Board of Regents in collaboration with the Association of Women Surgeons, the Resident Associate Society, and the Young Fellows Association on the importance of pregnancy, parental leave, and workplace accommodations for surgical residents and fellows. I'd like to start out with our president, Dr. Valerie Rusch, and ask how this statement came to be, what was behind crafting it, and how long did it take?
Well, Steve, thank you very much for convening us around a discussion regarding this very, very important ACS statement, which is actually not entirely new. It represents an expanded and updated version of a statement that was created several years ago. I think that the regents, like I, have felt for a long time that it was really unacceptable not to address this issue right up front. It's an issue that deeply affects the lives of all of our surgical trainees and younger surgeons in practice. And while it's particularly important to support women pursuing a surgical career or thinking about a surgical career, as societal norms have changed, it's also important to support men as they're developing a family, particularly when there are two parents in the workforce and not someone who's a full-time parent at home. So this approach, we felt very strongly, responds to a formal request from the RAS that was brought forward at the February Regental meeting, Board of Regents meeting, and was also a topic that was on the minds of many of us, as well as being prominently discussed in the lay press. And we thought it was high time to come forward with a fresh statement that would be really much broader and much more comprehensive than what the ACSs had recently. We feel very strongly that it will promote diversity, equity in the surgical workforce, as well as enhancing the well-being of young surgeons.
Thanks very much. Perhaps for some perspective from the earlier statement, which may have been circa 2016, we could turn to our past president, Dr. Patricia Numann, to talk about what changes have occurred over time that required this change and updating of this very, very important statement.
I think that with the increasing number of women pursuing surgical careers, now the entering classes are over 40% women. And with those years being the most important childbearing years, it's really critical to have a policy that is adopted by all and known by all. I was the chair of the American Board of Surgery when we actually increased the length of time that you could take for pregnancy during your first 3 years and then your last 2 years. And that was a step in the right direction. However, it was unknown by many people. It was applied randomly sometimes instead of across the board. And so having a policy by the college which addresses general surgery and all the surgical specialties is really critically important. We also see greater diversity in the types of relationships. And so it's important for same-sex couples to be treated fairly, for people who choose to adopt, even single parents who choose to adopt, to be able to fulfill their beliefs and their dreams relative to having a family and children. So that was critically important in the change. And the second thing that was very important in the change is that we all know that it's best for a baby to be nursed. And quite honestly, I got very tired of seeing people hidden in the bathroom under a sheet trying to nurse their infant with no place to store the milk other than with sometimes specimens, which was just so unsightly and unacceptable. So I think that this reflects the modernization of surgery, the inclusion of women, the lack of gender bias and of sexual orientation bias, and all of those things that make me proud of the college and the way it responds to problems.
Thank you very much, Dr. Numann, for those wonderful insights. I'd like to talk a little bit about how then the recognition of all of the important points which you raised came across at the Board of Regents. And for that purpose, I'd like to turn to our chair of the Board of Regents, Dr. Beth Sutton.
Well, I think most of us have had instances in our past where we saw surgeons who were trying to be good members of their family put in very difficult positions, and having had to see mostly young men make the decision to stay at work instead of being with their, at that time, wife, delivering a baby under penalty of losing their residency position, having to make that choice. I think that's where this sort of originated long ago in our hearts. And this statement is a labor of love from everyone who wants to make that better.
Thanks very much. And I do recall under your leadership having a very robust discussion with resounding support for the document that was produced, which wasn't produced quickly. It was a lot of tweaking and thought to ensure that it reflected the thoughts of the regions and of the other groups with whom we collaborated on creating this document. If I could next ask about the sort of daily implementation, some of the problems that were recognized leading, and we've heard some of them from everybody thus far, but Dr. Eberlein, you're in a position, you've been a chair of surgery at one of the premier programs for several decades, as well as head of a cancer center. So in daily life, how have you managed to deal with these challenges, and will the ACS document help you in that regard?
Well, I think it's the document itself is a tremendous evolution of the American College of Surgeons, and I think it has taken a leadership role. As a chair for a number of years, I've seen the evolution of the change in the trainees and young faculty. In our department, we have over 60% of our trainees are women, and over 30% of our faculty are women. And what I have seen is the opportunity to have children join their training for both men and women have provided the opportunity to recognize that they can have a balanced life. They can still have a family and still have a career, and the career can be rewarding. And so personally, I've been a big advocate for having women adjust to the ability to be able to practice as a surgeon and still have a pregnancy, and if they want to breastfeed, to be able to do that. And I think that that's a really important aspect of us being inclusive in our number of trainees as well as faculty.
Thank you, Dr. Eberlein. Certainly you've been a tremendous advocate, and that's apparent by what you've been able to implement at WashU as well as the discussions at the Board of Regents. Another tremendous advocate is Dr. Wood, and you have implemented a number of programs over the years which are well recognized for being able to introduce and correct these problems, not only recognize the problems, but ways that you've managed. And again, we've heard some of the other reflections, but could you tell us some of the programs that you've introduced at your institution which have helped advance this very important cause?
Yeah, thank you, Dr. Wexner. It's very hard as a male chair to necessarily know what's best. And so one of the first things that I did is establish a women's council in our department purposefully to advise me and the department, not just within the department, but beyond our own department to all of UW Medicine, of the barriers for women in entry, practice, and balance of their work life with the out-of-work life. With the view, and this is really nicely said by both Dr. Roosh and Dr. Numann, that this isn't just for women. This makes things better for men, makes things better for everyone. And the aspect of having a women's council help identify barriers and problems, in this case, around important issues of family leave, pregnancy, breastfeeding, and the time that's necessary to do that, to do it well, and to make it an important part of the life of our surgeons, has informed what we're doing in the Department of Surgery at the University of Washington. And actually, some of the work from our Women's Council has influenced this policy as well. That is an evolution of the pre-existing policy that was really more directed at faculty. I just want to emphasize that a really critical aspect as a chair is the fact that we need the American Board of Medical Specialties and the ACGME surgical RRCs to move and adopt similar policies, because ultimately our hands are tied if our boards or RRCs don't make accommodations also, so that there's not penalties for time, appropriate family leave time. And I think the college making a statement like this is really an important part of getting consistency across our surgical boards and our surgical RRCs, so that we are emphasizing the importance of parental leave and making it equal across the surgical specialties.
Thank you. You've done incredible work, and it's great that you're able to expand upon it for us during this interview. The beneficiaries, ultimately, the people who we're trying to protect and ensure that they have nurturing rather than any kind of castigation, are our trainees, our young surgeons who are having children. So I'd like to ask Naveen Sanji, who seems this evening to be representing both RAS and YFA, what has been the response of residents, fellows, surgeons early on in training to the updated guideline?
Thank you, Dr. Wexner. First, on behalf of RAS, the residents and associates, I would like to thank Dr. Sutton and Dr. Roosh, Dr. Numann for the initial statement, the Board of Regents for listening to our concerns at the Board of Regents meeting, and for taking this running but this important issue, which I know was on the agenda of the college leadership well before RAS brought it up as an important issue to us. Just for context, this year, it just so happens that 7 out of the 8 governing board members of RAS ACS happen to be women. The one male member of the executive council, Dr. Sun, who will be chair next year, has 2 young children. So there were a few things that were very important to us, both from the aspect of becoming parents while trainees and also the benefits to our children in the world of surgery. The first is having adequate time to recover from childbirth for women and for bonding and attachment for both men and women. And the second is that we as physicians extol the benefits of nursing and breastfeeding, and yet find ourselves in a position where it's really hard for us to practice what we preach to our patients. And so those were the underlying basis for the request for an updated statement. We thank the ACS for coming out with this strong statement, for increasing the amount of leave that we hope will serve as a guide for minimums for programs and not the maximum, which is generally the case. I would, on behalf of RAS, say that the statement, as we discussed before, has been revised and will need further revision in the future. Things change. I think this is a great step, and we really appreciate the support from the college because we're residents, and if we don't ask, we will not receive. We would ask the college to continue supporting us in issuing further guidelines for how programs can not only adopt to the spirit of the statement, but also take practical steps under guidance from this amazing professional organization for surgeons so that residents can feel empowered to take not just statements, but also guidelines to our leadership, and leadership have guidelines for how to inform changes within training programs. But again, we in RAS think this is a great step. We really appreciate it. Hopefully this helps programs develop some kind of standards. There are some programs that are really far behind. There are others that are already practicing what's in the statements, and there are some programs doing better. But by and large, programs need to catch up and support parents, support our children, support families within surgery.
Well, I'm sure that we will continue to do that. And after all, when you talk about the college supporting RAS and YFA are the college, not just the future of the college, but the present of the college. You're the energy that keeps all of us going, perpetuating, optimizing patient care, patient outcomes through what all of you are doing and the passion you have for surgery. So thanks for all that you do. We've heard a lot about the importance, why this document came into being, problems that have been encountered, solutions to those problems. I'd like to turn to the president of the Association of Women Surgeons, Dr. Stein, and ask about some of the specifics, some of the content of the guidelines.
Thank you. And the Association of Women Surgeons is really, thrilled to be part of this. I think it's really important. The American College of Surgeons has so much influence, not only over general surgery, but in all surgical subspecialties and specialties. And I think that this is really important in all fields. I mean, we see in neurosurgery and thoracic surgery, so few women, orthopedic surgery, where this becomes even more important. As far as some of the specifics of this, I think it's really important that this is not just for women. As was mentioned before, it reaches women and men. Any new parents through pregnancy, surrogacy, fostering, or adoption are advocated for in the statement. They advocate for a minimum of 6 weeks of time off for any new parent, and that's for either or both new parents. And it also allows that if there are complications or additional time is wanted, that as long as the board allows it, that it advocates for them to have up to another 6 weeks of time off. I think those are really important changes from the prior statement. In addition, one of the things that's really important is that when trainees go back to work, that they shouldn't be penalized for their time off, that they shouldn't come back in and have to take every 2 call in order to make up for time off while they were during pregnancy, during complications, or when welcoming a new member of the family. The college is advocating that if a trainee takes time off in order to be a parent, it doesn't in any way negatively affect their ability to progress as a trainee. I think the last really important portion of this is that there's also very specific guidelines that residents and trainees should be allowed the ability to breastfeed in a safe and comfortable space. As Dr. Numann alluded to, we hear so many stories. I think all of us who've gone through this and been pregnant know about stories that are really just uncomfortable. And for them to be allowed time to be able to leave the operating room, to leave clinical duties, to be able to breastfeed as necessary in a safe and secure space. And I think these are really important guidelines and really important advocacy steps in making surgery a more open profession to a diverse group of people.
I'm sure this statement won't be the definitive one, as the college recognizes the importance to evolve in all documents, and all of our guidelines, all of our documents are continuously reflected upon, updated as necessary. But it seems like at this point in time, we've covered the important points. We've recognized them. We've given very specifics, as you just enunciated. And thank you for doing so, Dr. Stein, as to what we need to do to rectify them and to address them. It also exemplifies to me the role of the college as the convener and collaborator, and whether that collaboration is amongst different disciplines within surgery, or in this case, amongst different associations, RAS, YFA, Association of Women Surgeons, the college, the regents, and I can see us reaching out to others, as was mentioned, ACGME and the board, And that is one of the very many strengths of the college, the ability to get people around the table, albeit in this environment, the virtual table, as we're doing with this interview, and recognize a problem, discuss it, propose solutions, codify the suggested solutions, and then disseminate them and see them put into practice, and then continually monitor them. And I think this group has very amply demonstrated that the college excels in many things, but certainly excels in the process of ensuring that not only are we all taking care of our patients, but we're taking care of ourselves, that we can take care of our patients, that if we respect each other, we're going to get a lot further and do a lot better job with our daily functions at the hospital. Now, unlike most of these other interviews that I wrap up myself, I'd like to turn back to our president, Dr. Rusch, to ask for any additional and/or concluding remarks.
Thank you, Dr. Wexner. I just wanted to expand on a point made by both Dr. Wood and Dr. Sanji. This kind of statement is extremely important. It sets the bar for what should be happening in the lives of our surgical trainees and young surgeons in practice. But it's important that we move beyond that to help operationalize the statement. And Dr. Wood is ever so correct that the ACS needs to collaborate with the ACGME and with the ABMS to operationalize this and make it a universal national standard that every surgical training program can abide by, and also that hospital administrators who control the dollars for all of this can look to as a guideline to which we all should be adhering. So in fact, the ACS leadership has already had conversations with the ACGME. I think that we are very much on the same page as the ACGME, and we have been told that they are very close to issuing a statement that is quite similar in content and approach to the ACS statement. And as we all know, the ABMS also recently issued a similar statement that has content that approaches what we have in the ACS statement. So with that, I think we are finally reaching a tipping point. It's taken a long time to get there, but I would foresee over the next year or so acceptance by all three organizations and implementation of this approach to parental leave policy across the country based on that collaboration between the ACS and the other two organizations.
Thank you very much, Dr. Roosh, for those additional reflections. I'd like to thank everybody for their time, the college for the privilege of being able to MC this issue of Surgeons' Voices from the front lines for the ACS Bulletin Brief, and know that we'll continue to work on behalf of our surgeons so our surgeons can work on behalf of our patients. Thanks very much, everyone.